So the role of RN, first of all, assessment the client, determine the plan of care, also care for the most critical or unstable client. Before to go number 3, I want to tell you, everybody know what are the steps of nursing process. So every steps of nursing process will be done by RN, like a assessment or diagnosis, planning of care, intervention, even evaluation, always done by RN, right? Determine the plan of care. If your patient need the teaching or during the discharge, so from beginning to ending or welcome to ending, welcome means history taking, initiate the process, even say goodbye means discharging, everything done by RN. Like I said, assessment, plan of care, interpretation of the laboratory test, evaluate the patient, everything. So, also most critical client, unstable client. Who is unstable? The patient whose vital sign is fluctuating, not within the normal range. Also, fresh post-operative client, they are not stable. That client with change in condition who need assessment means vital sign is fluctuating. Admission, during the admission, RN should do this. During the discharge, RN should be there. If patient transfer, like your patient have a tuberculosis, but patient need the radiology to go radiology department for chest X-ray. If patient has a leukemia, they need any radiotherapy and transmit to the radiotherapy unit. So transfer always done by RN. So assess the available staffs and their job description, what is called delegation. Delegation means, know who can do what. So the nurse manager or RN can delegate, the LPN can delegate the unlicensed person or CNA who take care for what. Perform the most complex procedure. For example, starting the IV, interpretation of EKG or ECG, correlate the lab values. So all kind of interpret done by RN, right? Collaborate with the other department and discipline. It is called interdisciplinary approach, or detect the supervision of LPN, other auxiliary staffs. Also act as a client advocate. So the act as a client advocate. So advocacy is an important role of RN here. So something I want to share with you. Like a patient are stable, suddenly patients start new complication. Who can deal with them? RN. Or if the patient complain anything new condition, RN will do this. If your patient need to put the restraint, RN is supposed to do this. In any kind of triage, always RN supposed to do this. NCLEX board asks a question like, prepare a patient for discharging. If patient need any kind of teaching, who can do this? RN. Another question I say, like a patient need to insert a peripheral IV channel. Who can do this? RN, right? Another question like, if patient need ambulating a patient the first time after surgery, patient need to transfer or ambulate. Who can do this? RN, right? Another question sometimes NCLEX would ask, triage patient, always RN, right? Admission like medication like pitun, a gynecology ward, obstetrical ward, if the mother need to put the pitun, so administer pitun to a woman in labor always by RN, right? Like feed a client with a dysphagia, like a patient has a difficulty of swallowing, who can deal with them? Aren't supposed to deal with them, right? In this note, I prefer, the reason being here, especially you see, these are variation among the state. LPN are usually not to allowed to some work. I'm going to explain what LPN is supposed to do. But before to go here, I am sharing with you what type of job it is not allowing or delegate LPN. So LPN are usually not allowing to perform the triage or admin the IV chemotherapy, IV channel with a cancer medication, chemotherapy, perform the central line procedure, like patient need fistula in the subclavian artery or total parental nutrition, central line, never ever do this by LPN. Administer the blood transfusion, so blood transfusion, never ever, right? Unless they have satisfactorily completed a transfusion training program meeting the criteria specified by the Department of Health and State Education Department. RN must be present for supervision. So under supervision, a specially trained LPN can do this. But basically blood transfusion always do by LPN. So now let me explain what are the role of LPN. So LPN provide care for the client with a stable condition. Who is stable? Easy. If the all vital sign within normal range. Or they can take the care of the patient under supervision of RN. Perform the basic therapeutic preventive care and rehab procedure. For example, sterile dressing change, also catheter or nasogastric tube insertion, application of restent under LPN RN supervision. Keep it in mind, under RN supervision. Assist the RN with unstable or complex client. So if I recap it for you, the LPN can delegation for tube feeding or indwelling catheter, sterile dressing change, follow-up teaching. So teaching always RN, but follow-up teaching can do the LPN under supervision of RN. Application of hot and cold therapy by LPN. Any kind of specimen collection, LPN can do this. Take any kind of measurement, LPN can do this, right? So before to go the last one, CNA work, I want to recap it in a short form. LPN can never do this IV medication or chemotherapy, blood administration, or care of plan never do this. Now go here, and before to go here, I want to tell you, NCLEX board sometimes asks, like I said, a patient came to a patient in the hospital and patient need discontinue a Foley's catheter. Who can do this? LPN can do this. Discontinue of Foley's catheter if the patient is stable, right? Like another question I say, administration of intramuscular injection. LPN can do this. IV never do this, but intramuscular can do the LPN or PN. Like I said, complete a sterile dressing change. LPN can do this, right? LPN. Like a patient need oral suction who is stable, LPN can do this. Another question I said, like follow-up teaching about a new medication, follow-up teaching, LPN can do this, right? Like a patient need a change of colostomy dressing and patient is stable, LPN can do this. Now